Cindy Hill, I'm on Mounjaro. I notice sometimes I get irritated when I take the shot. Not all the time, just sometimes. Do you have any advice? Hi, Cindy. Yes, I do. Some people, can have an allergic reaction to the medication. It can be irritating the way that it is. One, make sure that you don't give yourself the shot in the same place. I would alternate sides of my abdomen. Sometimes it's hard to remember. I would also maybe do a quadrant. I do 4 spots on one side, 4 spots on the other side. You also have the option of giving it to yourself in the thigh, but you don't give it to yourself in the middle of the thigh. There's a tendon there that will block absorption. And so you give yourself the shot, and it might not work. So if you're giving it to yourself in the thigh, you go to the inner thigh or the outer thigh, but not right down the middle, because that tendon sheath can block the needle going in. The needle is so thin, it's so tiny, it's thinner than a human hair. It also could bend. But what I recommend for the Ozempic patients and the Mounjaro patients, and for people who don't know, Mounjaro is the injectable medication for diabetes control and weight loss as well. It actually binds to 3 receptor sites. It is the better product, in Dr. Collier's medical opinion, than the Ozempic, but they both work. And so it's more important that you get the one your insurance covers versus the one, because there's not that substantial a difference between the two. But the Mounjaro is the better product, and it does result in quicker weight loss and more weight loss over time. Now, what you also need to do is when you put the needle in, that you hold the needle in place. You hold the mechanism in place. Most people, they squeeze an inch, they hold it here, they take it and put the needle in, you hit the button, and then click, click, click. After it stops clicking and you know you've given yourself that dose, I say do a countdown: 1 1,000, 2 1,000, 3 1,000, 4 1,000, up to 10 seconds to 10 1,000. And then wipe the area with an alcohol swab so that there's no medication residual sitting there. Oftentimes you'll get a little drop of it that comes back out. And so you want to wipe that off so it's not in direct contact with the skin. Other than that, it's obvious that you're not allergic to it or anything, because it only happens on occasion. So it's more than likely it's the technique that you use to give it to yourself that you're having that problem. But you should clean the skin area before and after the injection. But I like to hold the needle in place for 10 seconds. That way, when you remove it, there's less opportunity for you to get backwash and drippage and leakage. Okay, great question.